Thank you, everybody, for joining this webinar, and thank you so much, Noor, for accepting my invitation to come here and talk about
Mhm.
your journey and inspire all of us. Yeah, thank you very much. For a brief introduction of Dr. Shah, she is a graduate of Bilal Medical College, the same as me. And then after her graduation, she went to Aga Khan and she did her master's and there and she worked across multiple sectors in Pakistan, and she recently finished her research fellowship in Oxford. um, she is a visionary policy leader and emerging health diplomat, dedicated to bridging the critical gap between foreign policy and global health, an alumna of AKU and a recent research fellow at the Nuffield Department of Primary Care Health Sciences, University of Oxford. Her work focuses on the complex dynamics of healthcare inequalities between developed nations and LMICs. Most notably, she is a key architect of Pakistan's National Health and Population Policy for 2635, a transformative, decade-long strategic vision she contributed to during her tenure at Ministry of National Health Sciences, Regulations and Coordination in Islamabad. With an experience spanning WHO, FCDO, and Women in Global Health, she specializes in navigating power asymmetries to drive sustainable evidence-based health reform. Thank you, Noor. The floor is yours now.
I am Noor Ul Huda Shah. I am from Balochistan, and uh, I converted to public health recently, a few years back, and I will share more about myself in terms of fellowships because I was told to speak on how to score fellowships and what they are, and um, okay, just let me. Okay, so I'm your guide today. As I said, I am from Balochistan. I did my bachelor's from Bolan Medical College, and I am a dentist, by the way. I have a degree in humanities, and I have also a master's in health policy management and another master's in international relations. So, through international relations, I got to learn more about foreign policy, and I have another master's in health policy. So, my current platform, the diplomatic, which you see everywhere. The logo will be all over the slides. Um, yeah, that's about me. And I have two fellowships, one during my post graduation, my master's degree, and another a fellowship was recently at University of Oxford. So I will be talking about both. One was more academic focused, another was more research focused. I will also be talking about what are fellowships and what's the difference between a scholarship and a fellowship. Why should you apply for it? And if you are even eligible for it, if it's even the thing that you want in your career. So we can also do Q&A sessions, so you can, hold your questions, and we'll discuss that at length in the end. So basically, fellowships are time-bound opportunities. Minimum, they could be 2 months. Uh, in fact, I've seen a few even shorter than that, but I think the standard internationally is minimum 2 months, and maximum it could last for 4 months, 4 years, sorry. It's something a very dynamic kind of opportunity. It's not a degree, it's not a job, it's not an internship. Um, well, it's not a job, but you learn like you do in a formal degree program, and it's not a degree program, yet it pays like a job. So it's something in between. You get to learn and you get to earn as well. So basically, it's something you can do at your undergrad in terms of summer programs. There are a few months and a few, sometimes there used to be a program, Pakistan and US exchange program, which lasted for a year you can say pre undergrad, but it discontinued. So it could last a few months. and well, at pre-doctoral level and at graduate level after undergrad. So one of the fellowships that I earned during my master's, it was for 2 years, and it was by WHO. So WHO has this different alliances going on. They have one alliances which is called HRP, Human Reproductive Program, and I was funded entirely throughout 2 years of my degree, and I was even paid for my, accommodation, my meals, stipend, the tuition fee was covered, my research, even my travel allowance was given. So it was one heavy duty, opportunity, and the only thing they required of me was to build capacity in SRHR, sexual reproductive health and rights. So anything in the university that goes on under the umbrella of SRHR, you could say it could be domestic violence, it could be a seminar on reproductive health policies, it could be anything. So I was bound to attend that. And also in my master's thesis, I was supposed to take a topic which falls under the umbrella of SRHR. So that was the requirement. So they build your capacity and they fund you, but they also sometimes want something in return, which still is something that benefits you. Like I did my research on the topic, but still I got to learn about the topic for 2 years. So win-win, it has diverse paths. If any of you are doctors, medical doctors, MBBS, PDS, anything, we have a terminal a clinical training program which is called FCPS. That too is a fellowship, which is a clinical fellowship, and you also get paid for it, and it's 4 years long. You also build capacity in it, so that too is a fellowship. So clinical people, clinical graduates, they also earn fellowships. There are 2 year fellowships as well. Also, there are academic fellowships, just like the one I had the fortune to avail. And then we have professional fellowships as well. There are pre-doc fellowships like before PhD, and then there are some that you do after PhD for a year or two, and sometimes even 4 years. Like it's a lot, after 4 years of PhD, you do a 4 years of fellowship, but people do that. Depends on the work, and of course they are well paid. So I guess if you don't score a good job after a PhD, you can do a fellowship and get paid for it. So yeah, it covers this financial support, and it's usually goal oriented. As I gave my example, that they wanted me to do something along the program in SRHR, and that I did. So uh, also globally, the main aim of a fellowship is to build your capacity. They want you to become a better person. They just don't fund your education. It's not a narrow program. They try and build your capacity in different ways. Sometimes they mentor you. They design activities that would make you instill leadership skills in you. So okay, so all of us have heard scholarship, but few of us know the difference between a scholarship and a fellowship. So mainly scholarship only covers your tuition fees or sometimes accommodation, but it's very academic focused. Um, while a fellowship is again a capacity building. It could be work related. You can work in a lab as a biologist, a microbiologist, even a clinician. So you get to work in a lab and get paid for it. And there are fellowships where you teach and you do research and still get paid. It's not a salary like some countries and some programs consider it a salary, but it's it's a bit different in a way that you don't salary is like you work and you get paid for the labor, right? But in fellowship you also get to learn, and you there is vertical mobility as well. There is capacity building as well. Um, so you're kind of their responsibility. You're not just an employee. Okay. Well, scholarship focuses more on grades, but fellowships have their deliverables. Every application, every fellowship clarifies the kind of opportunity they are giving to you and what they want in return. They kind of make it clear the objectives of it. Okay. I think the slides are self-explanatory and trying to be more engaging. Um, okay. Why bother applying? Okay. So my motivation, firstly, during my master's program, the WHO one I applied, um, well, I needed a good financial backing, to be very honest. I needed financial support, and it gave me that. I didn't know what to expect, and I had a very low bar of fellowships, and I barely had any clarity of what it would, give me. Um, so that was a need-based thing, right? But the second one, the one the one where I went to Oxford for a research thing, that was completely deliberate, right? I made a research proposal. I reached out to different universities. I think I should talk about that more because that was on the flyer. So maybe I should build on that opportunity. Um, so yeah, I applied because I wasn't sure if I should go for a PhD yet, and I also needed a break from job. So I had a very hectic consultancy job, and it was like super demanding. So I kind of needed something in between, something that pays me, that builds my capacity, and I wanted to visit rural England and have some fun. So I applied for it, but I had to work a lot to get their attention. Um, the reason for applying, as I said, you can do a lot of networking. I went to a completely different country with new people, new language, new culture, and everything was really, overwhelming, but in a good way. So you get to network a lot, and then the professors you work with, sometimes they like your work and they offer you a PhD or a job or some other opportunity, a project maybe. So, and also you learn from your peers, right? um, uh, by engaging with them in different conversations and hanging out with them, you get to know what their life is like, if they're happy, if they're doing well, if they are for instance, at Oxford I saw people would graduate um, as early as they say on the flyers or on the advertisement. Like if it says a 3 year PhD, most of the students would graduate in 3 years. So it says a lot about the supervisors and the kind of system they have. And sometimes when you visit institutions, they would say we are here for like 8 years, 5 years. So you would know the kind of reputation and if the students are unhappy, if they are, if you would fit in a culture. So it's a good pilot testing of your resilience, of what you are expecting, and also the kind of the kind of commitment to expect. So maybe you won't like the culture of that country where you're moving. It could be just a 2 month pilot testing, and you hate it. You hate the weather. You don't like the culture. You don't like the people. You don't like the food. You still have a chance to step back because it's just 2 or 6 months or maybe a year. It's not 4 years like PhD, right? So it's a good opportunity to test yourself and build leadership skills. You can also build your soft skills. There are a lot of things that maybe you have never been to a hostel or a residency program. You can see if you are able to adjust without a family. You can survive the loneliness that there is out there. And well, it also has a snowball effect. If in case you don't know what snowball means, it means that you start with something small. When you have a small snowball and you roll it down the hill, it gets bigger and bigger. So you just enter a space for a small, project or or a research thing, but you end up making a lot of connections in different departments, different people, maybe the kind of person you. Okay, okay. So yeah, I see. Um, Also, it has some benefits in immigration thing as well. If you are you know uh, acquainted with the culture there, you can apply for the green card. If it is like for 3 to 4 years or maybe 2 years, you can think about that as well. Okay. Um, so who can apply? If you see it happening, it leading to your career goals, if it helps you achieve something that you want to achieve, I think it's the kind of opportunity you need in life, you must go for it, right? It always depends on the kind of fellowship you're applying for, the kind of opportunity you apply for. And basically, there is something for everyone. There is one opportunity waiting just for you. And whenever you hunt it, you would realize that this is my thing. Okay. Um, so, yeah, how to win it? I mean, right. Uh, this is the kind of thing you're going to work for, but how to do it? Okay. So, firstly, you have to, I believe LinkedIn plays a good role in it because a lot of supervisors are on LinkedIn and they look for the profiles. And, the sooner you start building your LinkedIn profile, the more credibility it will have. You have to be strategic. Don't go for everything. Don't apply for everything there is on earth, right? Just sift through the opportunities that feels right and apply for it. But don't be too specific. Sometimes you might get rejected if you like one or two opportunities and confused about five of them. I think you apply for all of it instead just going dropping your CVs everywhere or doing nothing at all, or just applying for the one opportunity you have your eye on. So I think the more you broaden your horizon, the better it gets. For instance, I'm a health policy professional, and well, anything that comes around policy, be it public policy, foreign policy, a little bit, close to my area, I can always go for it, but not like something out of the blue, right? Um, so, yeah, when you are doing your, building your application, you have to be more organized. You have to be very professional and take your time. Just don't rush into it because they actually read your applications. They give it a lot of thought, right? And it's best that you put yourself on the best foot. Um, okay, so the third point is my favorite. I don't know if I can explain it a lot, but I will try. So if you have done any volunteer work or leadership work, because they are looking for people who have potential and they can amplify that potential into good use. So you have to show that you have that thing in you that they can utilize, right? um, okay, so you have to have a plan in your head and see if you meet the eligibility criteria, but I think it's not necessary that you meet 100% of the criteria. Sometimes you might lack, um, uh, but if you wait for something that is just for you, that thing might never come, Sometimes you have to take chances. Okay, so I have listed a few links that I think you can ask Janita to give you. She can upload on her profile, however, whatever she likes. It's her platform. So you can take it from her, and these are clickable. They have embedded links, and I think these are one of few very um, uh, globally renowned links that have a good list of opportunities. So I really hope you find that helpful. Um, so yeah, that's about me and about the fellowship. If you have any questions, please feel free to ask.
Currently, I am a fourth year medical student, and I do not know. I just know that I do want to do a fellowship in the future, but I'm not sure which one, right? So, what are the steps that I can realistically take, Abhi, say, that would empower me to participate in something like that?
You're very young. You're in fourth year. Okay. The life. you're going to build is just starting. So it's good to envision it, but don't get anxious, okay? And don't overthink it. There are some good exchange programs you can look for. There are good research capacity or summer programs for undergrads that you can look for. I think that would be nice. Also, I would recommend to start building your capacity in research from now, because undergrad is a golden time to learn the skill, and everyone in the world, even in Pakistan, some of the universities I know about, AMC and Aga Khan, they are teaching their students good research skills, and then there are private platforms as well. I think every undergrad student must know how to do must know the basics of research, and at least they would be able to, put up 15 to 20 references paper, 2 to 3 pager at least. They should know the skill. I would really recommend that, because most of the people don't go for public health or a master's MPhil program. So you may not get a chance to learn it later on, and you may not have the energy to do it. So I believe this is something you can start learning now, and then the opportunities will come up, and you will also know what to do, what to look for. It's mostly about what you want in life. If you need more clarity, you can ask.
That answers my question. Thank you.
Thank you so much, Noor, for all the guidance that you are giving to us. And this is me, Dr. Abiha, and I'm from DMC, a recent graduate in the MBBS discipline. So, my question is, I am currently working as research fellow in a clinical trials unit, right? And yeah, so that my core interest is shifted toward the non-clinical side, working in a trial setting. So currently, I'm also enrolled in a short course at Oxford University for lower middle income countries related to the clinical trials, and my ultimate goal is to do a MSc over there, right? So, like, what kind of opportunities can we look for? Does there have any fellowship programs related to the clinical research? Because the MSc program is a good opportunity at Oxford, but it is very competitive over there, right? So we should look for it related to the clinical research setting. Any not only in the Oxford, but also like in WHO, there are multiple ongoing projects that they are doing in the low and middle income countries also. So, like, can you provide me some opportunities regarding that?
Actually, I'm so impressed. You're an undergrad and you're already doing so much work, and it's really, really impressive. And I think very few students are, courageous enough to use the time that we are. Well, I had wasted a lot of time in DMC, but it's so great that you're utilizing it in such a wonderful way. And I would like to know more about the clinical trials that you are doing. Okay, so there are a lot of opportunities. The organization I'm working with currently in Pakistan, I'm kind of leading their clinical trials, but they are mostly around drug and drug testing, psychiatric drug testing. So there are psychiatrists, there are doctors, there are public health professionals that are doing it. So you don't have to shift completely to a non-clinical career. You can always do that. Being a clinician, maybe not in Balochistan, but everywhere in the world, doctors, medical professionals, consultants, they are doing clinical trials. They are also, offering their expertise. A cousin of mine who is very young, who is also a recent graduate, he has started his startup, and a lot of international students have, collaborated with him, with Preston University in US, and they have hired medical graduates, consultants, for insights. So you could be that. You can consult companies and give your medical expertise, offer your medical expertise to them. And well, there are some very good 2-year programs. I think we have one graduate, Hamal, had a fellowship, I think 1 or 2 years at Harvard. Oxford has very good programs in clinical trials. And these are just one of the few famous names, but I'm sure that there are wonderful organizations in Europe, especially Germany. They are offering a lot of programs as well. So you are already building capacity, and you have an impressive resume. Uh, I think you're going to do great. You just have to be patient and try to maximize your network. I cannot emphasize enough on that, how important building network is, because you can only sit behind the screen and do enough. There are a lot of people out there who are looking for people like you, and they would love to reach out. And you should have a LinkedIn profile and market yourself well. People are gonna reach out to you on their own. So that's something I can
My
advise.
only concern is that we have the postgraduate education regarding the clinical trial specifically in Pakistan. There is no postgraduate degree that we can do right now. Like
That's
most of the
right.
people go for the public, most of the people go for the public health, right?
Yeah, yeah.
So that's the main concern. Like I'm attaching at a clinical site. That was my ultimate goal after MBBS के मुझे किसी तरीके से site पे मिल जाए. So that I am doing it ना for the
Mm-hmm.
experience building. But obviously it's not there's no growth in that. Like you have to do some postgraduate education. You have to move out if there is no opportunity here in
Move
Pakistan.
out. Move
So
out, my dear. You will have to move up sometime. If you have big ambitions, you have to explore the world and just be open to it. I mean, if Pakistan doesn't have it, maybe you're going to be the one who brings it to Pakistan.
thank you.
I'm not sure. Like there are a lot of layers to it. Who you are reaching out to and where and cold emailing. Well, in my opinion, in my personal humble opinion, cold email works for some people, but I always try and personalize it. It takes a lot of time, I know, but you always have to personalize it, because those professors, just put yourself in their shoes and imagine you are getting 100 emails a day. How would you be able to respond to them and in a positive way and read all of these? And there are countless other people they have approached. So okay, so the template I used for this specific fellowship at Oxford. So I was told by British Council that if I get a fellowship opportunity anywhere, any UK based university professor, anyone who is willing to host me, they will pay all my expenses. So I just had to secure one invitation letter from a professor at any UK university, right? And I applied for almost, I think, eight or nine, and I got in five universities. So, firstly, even those who did not accept me responded to my email, which means that emailing works. Um, Secondly, the ones who applied, even the ones who could not help me out, they offered help. Like I mean, they could not employ me, they could not host me, but they still offered help by offering me their connections. So it means that people there, they have a deadline, they have to reply to you in 3 days if it's relevant, and they try and help you out. So maybe there is certain format that you have to use. I will tell mine. You can devise your own plan. But my plan was, in first paragraph you have to introduce yourself. Second paragraph you have to tell what you are going for, right? For instance, I'm applying for this opportunity, and this opportunity is about this and that and whatever. In third paragraph, I wrote that third paragraph I kept changing because my introduction wouldn't change. The opportunity I'm applying for, it's not going to change. Third paragraph was about that professor I was emailing to. And firstly, the two institutions that did not accept me, I was making this mistake. But later on, I changed my strategy and I looked that professor up, sometimes on LinkedIn, sometimes on their university websites. They have everything on their websites. Like they're very, responsible that way. So you can look the professor up and see their credentials, their interest area, what they are working on. For instance, in health policy, they were addressing inequalities. They were, working on discrimination, gender-based violence, anything. You can just pick it up. So I would cater the sentences, one or two sentences. For instance, I'm inspired by your work in dash. So that dash would be specific to that professor. And once they read it, they would know that you have reached out to them and not everyone under the sun, right? I think that this works sometimes. But again, it depends on the opportunity. And then after I got the response, they asked me for a proposal. So I had to also make some, make different proposals and different ideas to convince them. So I think there's no one size fits all, but you have to make it feel more personalized.